Hello, everyone, and welcome to the Oklahoma News Report. I'm Jason Doyle, filling in for Rich Lenz. The COVID-19 pandemic has been hard on virtually everyone, and some Oklahoma lawmakers would like to use federal funds to help, especially when it comes to our children and their mental health. It could be a first step to helping bolster mental health for Oklahoma's youth. As the COVID-19 pandemic has played out since the end of 2019, suicide attempts among Oklahoma's youth have increased.
COVID-19 has really impacted children, especially in Oklahoma. We've seen widespread depression and anxiety. We've seen increasing deaths by suicide and drug overdoses across the population. But we've seen that children are particularly impacted.
The increasing need has spurred the Joint Committee on Pandemic Relief Funding to approve a project which will create emergency mental health bed space for youth at OU's Children's Hospital.
We're looking at about $7.5 million just to get in and go to work, and which is going to be phase one of handling these children.
Senator Roger Thompson is the co-chair of the Joint Committee. He says the emergency beds are the first step in a $58 million comprehensive plan to bolster pediatric mental health services in our state.
But the overall plan is we can bring these children in, they can stay there for a long period of time. They can be taken care of for a long period of time. There'll be feeders that will go out into the community to other mental health organizations that can work with the children, but can also work with the home and work with the parents. Because, you know, if you've got a really troubled mental health child, that impacts the entire family.
Even before the pandemic, Oklahoma's youth were already showing signs of mental health distress.
They're already troubled children to begin with. We've got to do something. And so this became an urgent, immediate need.
Does it look like we're seeing accelerated growth of mental health needs among our youth because of the pandemic?
That's a difficult question to answer. The best answer that I have is the children's mental health crisis started far before the pandemic. If you looked at the trend lines of youth suicide and youth anxiety and depression, they had been going up for years. But what we had seen during the pandemic is really an increase in those levels. We saw that trend line spike and go up much more sharply than it had been before.
The pandemic has revealed significant gaps in mental health services for children and youth, which could lead to other healthcare access issues.
In the Integra system, for example, you've seen more than double the number of children presenting in emergency rooms statewide with suicidal thoughts. St. Francis and Tulsa, you've seen almost a 90% increase in that. And these hospital systems are really sounding the alarm that, hey, so many children are coming into our doors with mental health distress. Sometimes we actually don't have a bed for somebody who might have the virus of COVID or a broken leg or some other physical condition because there are so many kids sitting in those hospital beds.
Stoikov adds that regular emergency rooms are simply not equipped to handle a mental health emergency.
The hospital emergency room is not an appropriate place to get appropriate mental health care. There is really supposed to be a treatment system that handles trauma, that connects families to resources and ongoing care in a way that a hospital emergency room does not.
The Oklahoma Institute for Child Advocacy praises the move by the legislature to address the need for comprehensive mental health services for children.
If we can get to this early, especially with what we faced in the pandemic, this is going to help us long term. It will help in a generational way. If we can help these kids now, we won't face those issues with them as adults later on down the road.
Dorman agrees that the Children's Hospital Emergency Mental Health Bed Project is an important first step to improving lives.
With what we're seeing with this investment, I'm convinced that it's going to get us on the right path to seeing better things for the state.
Once we shore up that immediate crisis, after the crisis, there needs to be follow-up care and connection to ongoing services. We really feel that the follow-up care component and the long-term needs of children with really acute and long-term chronic conditions is a major gap. We just don't have that level of care in Oklahoma.
Thompson notes that talk of improving mental health offerings to young people have been in the works within the legislature.
Last year, we began to talk about mental health in Oklahoma, and I'm a huge proponent of mental health. I learned that our most serious children are being sent out of state. I've said a number of times, we're better people than that. We need to do something for our children.
Thompson hopes to see the push for better access to mental health care go beyond the current project at Children's Hospital to impact a wider population.
Not only with the Children's Hospital that we've talked about, but we're looking at something in Tulsa with a new VA center. There'll be a new mental health hospital that'll be built there. And we're talking to OSU about some adult mental health emergency room beds.
He also agrees that if a distressed child can get access to the services they need before the situation becomes dire, it will lead to a brighter future for that child.
If we're able to bring children along at a very young age and help them, they become very productive citizens for Oklahoma. And that's good for Oklahoma, but I'll tell you what it's really good for, it's good for those kids. Because now then they can have a quality life as they go forward. That changes lives, and that's what we ought to be about.
Senator Thompson expects Governor Stitt to approve the youth mental health emergency beds using ARPA funds, even as more projects addressing the issue come up for consideration before the Joint Committee.